Hi, everyone. Welcome to another P.A.D. Leg Saver Hotline with Douglas and myself. We have a great live studio audience. We're even blessed to be joined by Dean with Patient Pro Marketing, doing some great things in the world of embolization and PAD. We love you guys. Have Beth here and Thomas here and Bonnie and Imelda just joined us. And so we got lots going on. Douglas, any update on you as we get started? I know
Well,
that you were,
I would love to bring up the simple fact it's October 1st,
oh, yes, it
and
is.
it is. But I really would love to bring up the simple fact of what an amazing month of PAD awareness we had with all the doctors,
Yep.
all the learning, all the stories, all the inspirations of hope, courage, and strength that we heard all month. And for me, it was especially listening to some of the doctors and how they care and how they literally go out of their way
Yep.
and being able to find those doctors and those people that we just give us that hope, the courage to keep going. And everything, I talked to a couple people today, and everything you did this month, Kim, is above and beyond. It is amazing what you were able to accomplish for us and all of that and bringing these doctors online and giving us all the things that they gave us all month. And so from all of us out here, we want to thank you and tell what
Thank
an
you.
amazing. And I had an Oscar here for you, but I can't find it. I'm sorry. I lost the Oscar somewhere, but I'll find it. We'll give you an Oscar for this month.
That would be great for entertainment purposes only. But
So
the Emmy for news and Oscar for entertainment.
it was
Um,
an amazing month that we did have.
I think the highlight for me was Representative Kim Schofield from the Georgia House of Representatives, District 63 in the Atlanta area. She gave us the very first proclamation for Pad Awareness Month in Georgia. And I thought that was incredible. And then above and beyond that, she agreed to champion new legislation for coverage for early testing for PAD. And she's already drafted the legislation. It's incredible. She's going to take it up first thing in 2026. And guess who else we ran into that I just connected her with? Legendary Harlem Globetrotter Larry
Oh,
Shorty
really?
Coleman. He is back and he
Awesome.
was asking about Sir Douglas, is who he was asking about. And since it's the 100th year anniversary for the Harlem Globetrotters in 2026, Representative Kim Schofield is going to bring him to the state capitol and honor him for his participation in the Harlem Globetrotters and now as a legendary Harlem Globetrotter, and even more, work with him to educate the other representatives about PAD. As you know, he did lose one leg, and when he found us, we were able to help him to save his other leg, which I was so glad that he and I reconnected because he recently had gone to another doctor and he's not too thrilled. So we were able to hook him up right away with where I think Dean here from Patient Pro Marketing, I think your girlfriend you said was in Georgia? Yes, he says yes. So it was in North Atlanta Vascular over in Lawrenceville with Dr. Mehdi Joshi. And he was kind enough last night after hours, 9 o'clock at night, which was incredible. 9 o'clock at night, he was like, hey, I'm answering your call for help. I will call him personally in the morning and is getting him in first thing Friday for a review of his case. So it's really important to
Awesome.
always have a doctor that will see you. And he wasn't seeing the doctors, he was seeing an assistant or a PA or nurse practitioner. If you want to see your doctor, you should make sure to request to see your doctor. And because he couldn't, and he wasn't comfortable with what was being said, as he already lost one leg, he was getting another opinion. Never be afraid to get another opinion.
And how
So I was
many of
glad
us
that these
in here?
doctors rose to the occasion.
how many of us in here grew up watching the Harlem Globetrotters? I was born and raised in Houston, and I remember they always coming to the Astrodome and driving down and watching the Harlem Globetrotters.
They
My
came
dad
to
remembered them at the YMCA.
they came
remember
to
Yeah,
like
Vancouver
ninth
every
grade,
year.
they actually came to our school when I was in like fourth grade in Schillsburg, Iowa, which was a real small little country community.
Really?
Yes,
That's
and
great,
and
Beth.
it was
and
cool.
think of
Yeah.
How
yeah,
fun.
think I was watching Colorado football this weekend, and I was watching Deion Sanders walk across the field, and all I could think about was what he had been through,
Yeah.
and what and this month I think it brings both how much education was passed out, how much word of mouth is out there now. I've been a part of you, Kim, for 5 years, and I can see the difference 5 years ago to today and
Yep.
how much it's changed and how much with that lady in Atlanta. Look at look at what is transpiring to make a difference in the community so
Mhm.
that we're not PAD patients aren't the redheaded stepchilds of healthcare.
Nope. It's interesting. We just talked to a vascular surgeon today in our UK hangout. It was Dr. Chris Twine, and he is in Bristol in the UK. And he was saying that he realized that at one point he decided to, and Joshua, our producer, said he was super cool. He really, really was. We asked him, why did you get involved with PAD? And my favorite new question is, why do you have a foot fetish? And it always gets a little chuckle out of the doctors. Got to make a little light in a very serious topic, not to make fun, but it's very serious. So they appreciate that little nudge. But he was saying that in vascular surgery, you're trained in the entire vascular system. You deal with carotids, you deal with aneurysms, you deal with the whole body. But he said, with those other things, he says, we've gotten a handle on those. With those, we fix it and we can literally, people can coast for a long time. With PAD, he feels like his practice has become all legs all the time. And that's when he was like, I need to do something because all of these patients are presenting at my doorstep in advanced stage critical limb ischemia or chronic limb threatening ischemia. And they shouldn't get this far. We got to get these people sooner. And so a lot of his research is around PAD. Right now, one of the things that he's working on is, and I think this is so fascinating, is the medication regimen following a procedure. So once you have your arteries opened up, then what's the medication? Every single doctor seems to do something different because there isn't enough evidence to show what is most effective, as you would see in the heart. The heart, there are everyone seems to be in agreement. The guidelines are all in agreement. But when it comes to PAD, do you give someone an aspirin and a clopidogrel or Plavix, an antiplatelet therapy, dual therapy, or do you give them anticoagulation? Do you give them, there was a Voyager study on a drug called um Xarelto, and there still is not enough evidence for whether or not, well, do you do Xarelto alone? Do you do Xarelto with Plavix? Do you do it with aspirin? Like, what do you do? What's the most effective? So they're studying that right now for patients who have had procedures.
What about
And I think that's pretty
statins?
cool. And then
Uh,
statins, there is a lot of evidence for statins for overall vascular health. But I wonder, and you bring up a good point, Douglas, because for a long time it was, they were all studied for coronary artery disease, right, and the impact there on the heart. I have never actually, maybe Dean can do this for us as we're sitting here and could chime in, but I'm curious, and I've never looked up, and I'm sure there have to be studies on peripheral artery disease and the impact of statin therapy. How effective are there, mass studies on that, on the dosage, on the different types of drugs, which ones are more effective? Are they the same? I would just be curious. So that's a really good question, Douglas.
Because we just heard our government say stop taking Tylenol, didn't we? We heard that argument this past
I didn't
week.
hear him say stop taking Tylenol. I think
They
that
said
there is a
It,
caution.
well, that
that
goes
was
to that.
over autism.
That goes
Pregnant
to,
women.
but it
It was a
goes to the
caution for
fact.
people who are pregnant.
Yeah,
Yeah.
Yes.
but it goes to the fact how many different viewpoints are out there and what kind of studies are out there for PAD that we can follow that we know are effective treatment for PAD. Now we know 3 words: walk, walk, walk. We
Yep.
absolutely know that, don't we? That's a given. That's an automatic given. But how different are we all when we take different medications? Because we all present different, don't we?
Yep.
Yep.
Well, we both present different and we
Hi,
react
Alan.
different. Hi, we present and react different to drugs.
Yes.
So,
And there's even Dr. Anita Dua from Mass General did a study on Plavix or clopidogrel and one particular statin and found out that the Plavix was not as effective with this one particular type of statin. And so it was really important also for Plavix if you don't, I don't know if it's if you don't have a sensitivity to it, but there's some people in which Plavix is not effective. And so there is a Plavix sensitivity test to see if it would be effective for you. And a lot of doctors don't know to do that. And we've had a number of times where the patient has been on lifelong Plavix following a procedure. And it turns out when I ask the patient to just make the request to the doctor, what does it hurt to at least get the sensitivity test? And lo and behold, just about everyone was sensitive, or it was ineffective for, and they ended up switching them to a different antiplatelet. I found that interesting.
And think about it, not only PAD, but how many of us also have comorbidities, diabetes, heart disease, emphysema? How many of us should stop smoking, but we're not through yet? But we need to be smoking. How hard is it to eat properly to help us with our PAD and all the other things that we go through? So not only it's like a whole life altering circumstance that we need to adjust to in it.
Yeah.
Especially, I know, Beth, you're certainly nodding your head. So many
Yeah.
things, right?
You don't know, but I just recently found out that I now have emphysema on top of everything else I've been going through. And I
Oh
just
my
suffered that
goodness.
second stroke. I just had that second stroke on 9/11. And now I've just found out that I've got emphysema on top of all of it. So,
Oh no, Beth.
but you know what? But you know what? I'm still alive. I'm still breathing. And I can just take it one day at a time. That's all I can do. And I have both of my legs. I'm blessed. You know,
Yeah,
that's it.
that's
I just
right.
keep moving along,
That's,
and that's what I can do.
yep.
And walking
How,
is good for your lungs too, you know.
yep.
Yeah.
So, and I'm sure your pulmonologist has shown you a way to breathe
Oh yeah, I know. Yeah, I know.
and cough all that crap up. Plus, you've been almost a year. You haven't smoked.
Yeah, December 15th
Wow.
Yeah.
with my head of
That's
cigarette.
that's one step at a time,
I'm
isn't
so
it, Beth?
proud of you.
Thank
Yep.
you.
It
You
is. And we're
know,
here for you. And
I know.
I like the way you think. I know it's not always easy to think like that, but every moment that you can is a really good thing to start trying to create a habit of thinking those positive thoughts, allowing yourself to dip when you need to dip, but the
Oh,
fact that
absolutely.
you do prefer to feel better, you do have beautiful grandbabies.
Thank
Mm-hmm.
you.
I'm adopting a couple of them.
You can have some.
and
They
I heard this word this morning, y'all. Here's a word I thought about all day long. here's the word, empowerment.
Yeah.
Think
Yeah.
about every morning we get up, that one step we take, how it empowers us to keep taking that next step and the next step. And how much of that do we really need for living with what Alan goes through with Marina's here. Hey, Marina, look at
Hi,
what
Marina.
Thomas goes through and what
I see
Wanda,
Wanda too.
yes. And so all of us, that word meant a lot to me. I heard that word this morning because like what Beth says, she gets up and she keeps going. And we could quit. Quitting is easy.
Oh,
Yeah.
there's days that I just want to say, what the hell, and just throw the towel in and, there's days I cry. And, there's days it's like, why me? Lord, I've had enough. I can't handle no more. Stop,
I know, right? I said the same.
just stop.
God.
I've had enough.
Right.
But,
Yeah,
and
Wanda,
I
you
know
you
we all
agree.
do it. Yeah,
Yeah.
we all go through it. You know, I you're fool if you can look at me and tell me no, I don't go through it, I'm gonna look at you and tell you that you're a liar. Because
Yeah.
we all have our down days, but it's just something that we have to get through. And it is hard. It's not easy, but it's just that one day at a time, and that's all we can do.
Have you ever thought about all the stuff you've already been through in life and you're still here? Because I'm
Mm-hmm.
sure this is not the only struggles we've ever been through in our lives.
Nope, it
I
isn't.
No,
guarantee you it's not. So think
Mhm.
about
No.
that. All the stuff we've been through, all the stuff that life throws at us, and we're still here. We're still getting up. That whole point is being, I have to become my best advocate today. I have to be my best advocate. That means getting up, putting my shoes on, and taking that first step. That
that's right.
means eating properly, stopping smoking, doing all the things that I need to do, being a part of this group, sharing my inspiration, my hope and courage with somebody else, and getting the same from each and every one of you. How
Yep.
much does that empower me to hear your stories, what Alan's been through the last 3 months, and he's still going in it?
Yep.
That's
Yeah.
amazing, you know?
I know Alan's got his cute little Charlie Chaplin going on there.
Yes,
I,
I
th-
His
do.
his battle scar.
I was
I
thinking,
I lost I lost about 2/3 of my scarring in my forehead and my nose. So
Oh
that's good.
no. Took
That's
a little bit
good.
of a spill.
you
Yeah.
do look
And
a lot better. You look a
thank
lot.
you.
I was, Kim was nice. She thought Charlie Chaplin. I was thinking Hitler.
If
No,
Oh
Oh,
man.
no.
if I'd made
Wanda.
if I'd made the hair red, I could have passed as Hitler, yes.
But you're too
Oh
kind
my goodness.
to be.
Goodness.
I was
We-
going more with the whole Oscar
I
theme.
know. Yeah.
Yeah, yeah,
Yeah.
Entertainer of the year.
yeah,
Not
yeah,
dictator of the year. Oh my
yeah.
goodness.
Yeah, we don't do
You're
politics,
hilarious.
so we don't do politics here.
Okay.
No, you can
Oh,
tell that Wanda and Alan know each other very well from our other group that we meet on Mondays.
Yes, yes.
And the inside joke now is Alan and I are going to get a couple more people here together, and we're going to get discounts on those little necklaces. Help! I've fallen and I can't get up.
Yep, yep.
One,
We're thinking maybe we could get discounts on those now.
We should. A
Yeah,
group discount.
between the two of you, my goodness, I think it's about time you stay on your feet.
uh,
But
Seriously. Just
it's
like
a
Bonnie, right, Bonnie?
yeah.
Yeah,
Bonnie, tell us
sure is.
what's going on with you. I know you have a bit going on.
Yeah, when I first went to see the vascular surgeon, he wanted me to join this walking club that they have at the hospital. And in the notes that he wrote, he said it might not be possible. We might have to do emergency stenting. And I tried to explain to him, no, I can't physically move my legs. I cannot walk. I could, like 5, 6 feet and I'm fine. But after that, then my IT band that had to be stretched, which is inflamed again. So I can't move it. I can barely move it. So what I started doing is having that soft wave treatment. I don't know how many people have heard about it.
Haven't heard of that.
It's it looks like an ultrasound machine and they gel your leg up, okay, for me. And then it's kind of like an electrical shock to all the damaged areas. And the stem cells from this stem cells will activate and come up around and start healing immediately. The very next day, the lower half of my leg, I absolutely had no pain. And I'm going to continue for 6 full treatments. And possibly then I won't have any problems and I'll be able to walk back normal. But my walking problem wasn't due to P.A.D. It was not due to claudication or any of that. But he wouldn't listen to me, so he dropped me. He didn't care what I had to say. My physical therapist said, I don't think he's correct. She goes, I think I know what it is. And it was my IT band.
What is that?
Wow.
If you don't mind me asking, what is an IT band?
That's your, well, greater trochanter band. Okay, it starts from around the bottom of the knee and it goes up the side, kind of in the center side, and then wraps around the upper part of the gluteus, around the hip and the gluteus. So you get pain from there all the way down to the knee when you try to walk. And when it's really tight, well, they had to go in mine. And what they did is they cut a bunch of pieces and then they stretched it so I could walk again. But you can't keep doing that. So that's why I chose the soft wave to start the healing process because nothing else was working.
So it's not your vascular that is causing you any problems?
No, I don't think so. I haven't seen him yet. I've been back because he dropped me. So I thought, well, I'll just find one from Kim then, forget it. Or I'll just go see John Blow. And if I don't like him, I'll go to the next city up.
Has
Well,
any of your doctors diagnosed you with PAD at all?
Yeah, they checked. They said I had it. But nothing's been on. The only thing they did was gave me a rovastatin.
Yeah, statin.
That's it. No other appointments, no other further checking. My blood pressure has raised up quite a bit. I've always been low, but I've never had any trouble. Now I took it last night and it was 150 over, I think it was 65, sitting down and not doing much, throughout the day. No reason to have higher blood pressure. Mine was normally, 105 over 60 or 110 over 60. And now it just went a little crazy. They're not doing anything.
How long ago did you have the IT?
Strange.
That was 2 years ago. And
Hmm.
then all of a sudden it started acting up out of nowhere. I don't know what I did. I could have, I was sitting on a couch that's quite a bit lower than your standard living room furniture is, which may have caused it because your legs are at a different position and you are straining all your muscles when you sit like that.
Do you have any resting pain? What about at night? How do you feel at night? Sleeping?
I feel good after I started these treatments. I don't have any problem sleeping anymore. Um, I don't have pain anymore. I'm going to follow through with the treatments though, because I want to know for a fact that I can go for as long a walk as I want to. I did go out the other day, walk down the driveway to, it's one house over as a stop sign, half a block to the dead end, walk back and halfway up the hill and back home again with no problems at all.
Yeah, that's cool.
Bonnie, do
But
you
it's
have
not
do you,
like cramps. So, PAD is indicative of, especially if you're an intermittent claudicant, you end up with leg cramps. You have leg cramps when you walk. When you stop walking, you feel better. That's the traditional textbook PAD. And you're not
Well,
experiencing those.
that in the beginning, that's exactly what happened with my thighs. I went in because my thighs hurt, but it's because of the IT band.
And it's
The
both of
band
them
is thick.
equal. Okay.
Bonnie, do you have a vascular surgeon?
Nope, I had one appointment with one, and because I couldn't manage to walk this program, he just dropped me. He didn't want to hear any more about it. So I haven't checked out another vascular surgeon.
Yeah,
And
I'd
do
be
you have,
curious. We'll get you hooked up with another vascular surgeon. It's just good to reaffirm, but it's also telling that you feel better with what you're doing. You're able to walk more with the direction that your physical therapist has you going in and with this soft wave. So, it sounds like, but it's always good. We always suggest getting a second opinion, and it's good to know, even if you do have a vascular issue, it's your symptoms that matter. And if your symptoms don't match what they see in the imaging, then they're not going to treat you anyway with anything more than walking.
yeah, and
Yeah, wasn't I supposed to have some sort of imaging done?
well,
I didn't have any done.
that's what I
You
think you
haven't
need
had
to talk,
that?
you need to talk with a vascular surgeon about. What
Yeah.
you've described, I get mixed signals from. It sounds like you might have PAD, but you might not.
Yeah.
And only a vascular surgeon can confirm whether you do or don't. And so I
So
think you
they
need,
haven't. So
I think
Alan
you
hit it.
you
I
need to do
didn't
that.
hear. I thought you were diagnosed with PAD. You didn't have any imaging. You didn't have an ABI test
No.
or an ultrasound.
No, no.
No Dopplers or anything?
No, I had the ankle test. That's it.
Oh, see, she
By-
did. She had an
by
ABI.
So
Who-
she's
who-
had ABI.
What kind of doctor did that?
A technologist would do that.
A technologist, but in my world, that's great that a technologist does it, but a vascular surgeon has to go through that before there's any conclusion whether you do or don't have PAD.
Well, he did
All I
say
got
that
was
she
the
does have
paperwork.
PAD.
The technician did.
No, the vascular surgeon. She met with a vascular surgeon. He said that she had PAD and that she was to join this walking program. But the problem was she couldn't really walk. She went to her physical therapist. The physical therapist said, I don't think it's your vascular. I think it's this IT band. And she has been pursuing this other therapy that seems to be getting her on her feet and walking. It seems to be giving her relief. So even if she does have a vascular issue, if it
Mhm.
doesn't match the actual symptoms that are preventing her from walking, they're not going to do anything about it. So, but you're right? We need to get you a second opinion. We need to get another vascular doctor that
Okay.
will have the conversation with you.
That is so important for
It
all of
seems
us
like
to
when
get
you
that
go to the
second.
doctor here, yeah, you get an opinion, they put it in your my chart, and you read from there, and that's as far as it goes. They don't call you and say, hey, I want you to come in for a follow-up, or let's do this and this. They had me even go to a cancer doctor because all my blood work showed up really goofy, and they were looking for leukemia,
Oh no.
and I have to go
That's
back for that. But I have to do all of the work. The doctors are not giving me referrals. I call and I say, look, okay, I want a referral to so and so, and he'll say, okay, I'll make it. But he never contacts me. He never follows up on what the other doctors write in my chart.
mhm.
Well, I've been having a problem with my vitamin D was way down there. And he looked and he goes, no, I looked in July and it was just fine. And I said, well, you didn't look at Dr. Rooney's a week ago, which it was really, really low. Oh, okay. So I'm like, these
Well,
doctors are,
we see this all the time, Bonnie, where
Yeah.
It is, it, it is kind of strange how sometimes we call it a team, but how many times does the right hand not know what the left hand's doing? Or that's why we really do stress how important it is to become our best advocates, and
Yeah.
we need to stay on top of that. And
Yeah.
it is a struggle sometimes. It is um, difficult sometimes to keep that doctor engaged
Yeah.
because of everything they have to go through. And
Yeah, but if
that,
I have had, I want to pursue. What else do I need to do? What should I
Right.
do that I'm not doing, or what am I doing that I maybe shouldn't be doing?
Over a certain age, 1 in 5 people over 60 has it, but I think that the doctor was saying today that maybe 1 in 20 might have, an issue that might progress. So, for the most part, they're doing the right things in terms of they talk to you about a walking program. So, the soonest that you can get that IT band in control and you can get walking again, the best thing you can do is walk. Secondarily, uh, the other aspect of conservative therapy is the medication, and statins are normal as part of the PAD management guidelines that were issued in 2024. The other thing that they may want to consider, they'll also look at your other risk factors. If you have diabetes, they'll talk to you about a diet program. They'll also talk to you about whether medications are appropriate to help bring down your A1C if it's high. There's also blood pressure. You mentioned if you have high blood pressure, they'll want to get that mitigated as well. They'll want to give you some sort of medication to lower that blood pressure. Some of the things that doctors have talked to us about recently that there are conservative measures, even more conservative than medication. Beetroot powder is something that one of the doctors told me the other day that they actually write a prescription for beetroot powder for blood pressure for patients to get them started.
Huh.
And I thought that was really interesting. So there are people that add beetroot powder
Oh,
to
wow.
everything. I know Thomas uses beetroot powder, but a lot of people do. So that's also an option for you to talk to your doctor about.
Okay.
and
But it's
think
all
about that.
conservative therapy.
Yeah, think about that. From 10 years ago to where we are today and where we're going to be tomorrow with PAD and what they're learning every day,
Yeah.
and how it's on a constant change today, especially the techniques, the ability they can use today, and how we're affecting those doctors out there to get them to change and to think outside that little box that they kind of grew up in a little bit,
Yeah.
you know?
Yeah. And the other thing is, I don't like the fact that, okay, I turned 70. Now I'm in a different age group of comparable people. So you're just stuck in that little circle of, 5 years, 70 to 75-year-olds.
Oops,
It's
she froze.
typical for this. This
Oh,
is
everyone
typical for
froze. So
them.
it's my computer.
Yeah, I'm 64. What kind of group am I in?
You're under
The
me.
old
But
You
they
know?
just compare you with all the other people in your age. Well, I want to be individualized. I don't have the same things as a lot of 70-year-olds have. You know, I'm not the grandma that just wants to sit around and do nothing. But
I
all
hear
summer
you.
long, that's all I've done because I couldn't
Yeah.
walk.
Hey Doug, you're in the
And
Beatles
that's,
group. You're in the Beatles group when I'm 64.
hey, Amalda, how are
Hi.
you?
You know that song? Will you still need me? Will you still feed me when I'm 64?
bird. Yes, I remember that, Imelda.
You're in the Beatles group.
You're in the Beatles group.
The song, will you still love me when I'm 64?
Oh,
That's what
Lord.
I love it.
I was in a group the other day and I told somebody about my sobriety date, and somebody in the back of the room goes, "Yeah, I was born that day." And it was like, gee, thanks. I really feel old now.
you're not old, Douglas.
So it's like, Isn't it strange? Uh, if I knew when I was 20 some of the things I knew now, would I change some of the ways I treated my body?
Oh my God, yes.
I think we all would. I think we all
Definitely.
would.
Yeah.
But the one thing that a doctor said to me the other day, it was Dr. Salhanick, Mark Salhanick from Dallas, Texas.
I
He
like
said the number one, who said that? Who was on it? Oh,
I,
Wanda, you watched.
I liked that guy.
He
Yes.
was really thorough. We just put up a blog post that summarized, and even Joshua, our producer, said it was a really great interview. And
Yes.
one of the things that I thought was interesting, I probably could even pull it up if we really wanted to. He said, "I'm really tired of doctors blaming patients. I don't like that approach." And
Mm,
he said, "Okay, so much of this disease, of course, diet, lack of exercise, smoking, things like
smoking.
that. Okay, we get it. But is it helpful when you go in the room to play the blame game with patients and say, well, you caused this and blah, blah, blah? Is that going to inspire them to
No,
create the change that they
Um,
want to see?
not
Or
at
is
all.
it to sit down and say, you know what? We've all done things in our lives. We've all done things in our life that maybe if we would have known, we might have done things differently.
Yeah.
We're all paying for it in some form or fashion at some point with our health. But it's not helpful to go back and kick yourself. What does that solve? How do we move forward was really his message. Let's start with today and let's empower the patient to move forward, because no matter what you have done in your past, you can create the change you want to see today by taking action today, putting the cigarette out today, making a different choice in terms of what's on your plate today, taking that extra step, as Douglas always says, today.
And
yeah.
that word hope. Hope is an amazing word that
Yeah.
we can get up with. I guess hope and empowerment might be kind of the same thing, but when I get up in the morning and I feel hope, it is not that hard to take that next step. How many times I think about a circumstance. Saw a doctor in Houston on the 25th floor. And when I walked out of that doctor's office, I remember standing at the window in the hallway and I thought I might as well just jump, because that's what I felt when I left that doctor's
Yeah.
office. And so I think when we go to doctors and we talk to each other and we come to these groups, I think having that feeling of hope, Alan, it just brings me back to Alan all the time, is if I know what's wrong with me, I know I have something to look at, something's tangible. If I know I take that next step, I'm going to build a collateral. I'm looking forward to that next step. That gives me the hope of taking that next step, that what I'm doing is making a difference. How many times do we hear people think about Mike? He's a member of our group. He's line dancing. He did a 13K the other day, and he said, I walked through the whole thing with no claudication. He said,
Wow.
all those months of working before brought me to this. And think about that as,
Yep.
as we start the walking app or the walking program, and we can't walk 10 steps. 2 months from now, I'm walking to the driveway. A month later, I'm going next door. A month later, I'm at Walmart making the whole circle in Walmart or HEB, or I'm grocery,
Yeah.
or you're chasing your grandkids now, because it starts with that one step. And that one step is hope that what I'm doing is making a difference, and it will make a difference.
Yes, it will. I agree.
I'm curious, Douglas, what do you think? Should we go around? I'd love to hear um, everyone. I would love to hear your thoughts on hope, what it means for you. And maybe there it was an experience in which a doctor didn't instill hope, and maybe there was another instance conversely where they did instill hope that would inspire doctors to, you know, take note on what you're sharing.
Great idea.
I think that
Marina,
Douglas, you could start because you know who gave you hope was Miguel Montero Baker at Hope Vascular over in Houston. And he, in fact, just on Friday, oh, I haven't had a chance, Joshi, our producer, remember in the interview with Life of Flow podcast. If you guys haven't seen it, like this video, subscribe to our channel and go check out under live videos the interview with the vascular education, innovation in vascular education interview we did with Life of Flow podcast, because the doctor started talking about Douglas, didn't mention him by name, talked about how Douglas inspired hope in him. And they all started talking about your wood burning. And I thought that was the coolest thing, that they were so impressed with all of your talents.
well, and this may sound crazy, but I put my shelf up over my kitchen. I'm building a tiny house by hand. These two hands of mine now, I am building my own tiny house, 14 by 28. I'm doing all the wood. I am doing everything by hand myself. I put my shelf up last night. My friends left, and I remember standing there and I started to cry a little bit, thinking about where I was to where I'm at today and what I'm able to do now and
Wow.
how it just feels. But I remember one circumstance. Thomas will remember this. Dr. Walker in Houma, Louisiana. He's the first one I got to see after I met Tim. And he rolled across the room and put his hand on my knee and said, Mr. Southbury, this is what we're going to do. We can help you. And it was that very moment that I felt that was when I felt that hope that
Oh, wow.
somebody actually heard me.
Yeah.
Somebody actually paid attention to what I was saying and how I felt. And that's why Dr. Walker will always be that number one. And then Montero Baker, yes, he absolutely. But then I had the other experience where I just wanted to jump out. It's like Kay was on the phone with me, and she said, I have never in my life heard a doctor say what he said to you. Never. And it was like, I might as well just jump out the window because it was like, go home, get your affairs in order because you're dead. It's like, really? You're like, hello. So,
Wow.
and how many of experienced that? How many of you feel that hope today? And you need that sometimes to keep going, don't
Mhm.
you? So
Yes.
who wants to jump in?
I think Wanda does.
Oh, wow. I don't know. I don't know. When I was diagnosed in 2016, it was because my toe turned blue. So I went to the podiatrist. She sent me to a heart doctor, and I had an This is in 2016. I had an angioplasty. I kept hearing
Mhm.
him say, I can't. I was thinking, oh crap, this doctor doesn't know what he's doing. And my son was with him. My daughter was on the phone, and I was still hurting. And he came in there, and he told me, he said, "You did this to yourself, Wanda. You know,
Jeez.
smoking." And I kind of, I was like, "Okay, asshole. I mean, I'm sorry, y'all. I'm sorry. I am so sorry." I said,
Ain't no
"Okay."
You
problem.
speak from your heart.
Yeah,
You speak
yeah.
from your heart, Wanda. I
You
love you. You're
you just
amazing.
um I
Beep.
don't that's not gonna do me a bit. And so I was like, come on, let's just, we're gonna get out of here. And then 9 months later, it started showing up again. And I was referred to a vascular surgeon at St. Dominic's. Okay, this guy thought he was God, such an ego, but he did do a femoral endarterectomy,
Oh,
and
good.
it's patent. That was my second doctor. Third doctor I went to. Anyway, it wasn't until by that time I had found this group. I think I've been in this group 3 or 4 years. And so I, did a lot of walking, cut way down for me on cigarettes.
Good for
Absolutely.
you.
I kept Googling, trying to find a loophole where I could still smoke cigarettes. And because
I love your honesty.
I eat right and I walk. I said, well, 2 out of 3 isn't bad. That kind of went through all that crazy stuff. But it wasn't really until I was watching one of Kim's shows and I found a doctor that is in Jackson, Mississippi, where I live. Because when I first told Kim where I was living, she gave me a scaredy face. And I was like, and why are you showing a scaredy face? But yeah,
Oh, yeah.
like
Because
this
it was in the South and it's the amputation belt. And
I know we talked on the phone because I was like going, but at the University of Mississippi is where the first heart transplant was, um, and so I didn't give up hope. I was like, I'm just gonna, because I've been through it, like we all of us have. I've been through so much, and I'm like, okay, God, why do I have to have this? Here's my brother-in-law over here. He drinks beer every day. He smokes like a freight train, and he's got a gut. And here I am. I have the P.A.D. But then with my doctor now, he is so gentle when he explains things to you, you
yeah,
know, and he doesn't. He's very intelligent. So, but he teaches and he's very kind at the same time. He's a very busy man. He goes all over. He's known worldwide. I mean, he's from Nigeria. Um, but he could work anywhere and make a killing, but he chose to work in Jackson, Mississippi, where this area has become a very poor area. And I don't know how to say that. Minorities that don't have a lot of resources, he has chosen to give back to that community too. He's a very sincere man, you know.
yeah. I think he's one of only 2 or 3 in the world that have a trifecta of titles. I think he's a urologist, an
Yes,
interventional cardiologist,
yes,
and he's one more thing,
a nephrologist,
nephrologist.
nephrologist. He's got all these letters behind his name,
I know.
but he's not
And they're
egotistical. He's not how great I
yeah.
am.
And
He's
he's an
just
artist on the side,
yes, yeah,
talented artist. And he still
So
goes back to
it's
Africa. He goes back to Africa,
he
Pete,
does. Yes,
and
so it's made
he
a big difference
helps.
in.
yes, and then of course, I talk to God when I wake up at 2 o'clock in the morning, and I'm kind of scared because I'm like, man, if I lose a leg, I won't be able to work. What am I going to do? I can't. My son's like, Mama, you'll be okay. I will take care of. No, that's not fair. And I just like, I've heard of the heart attack, the widowmaker, where you just die in your sleep. I've bargained with God, just let that happen to me. You know, I,
Oh,
well, no,
I think that's what everyone wants. You would rather just like, if you're gonna
yeah,
take me, just take me in my sleep and just leave it at that.
my
That's what my dad says all the time.
right, my cousin's 43-year-old son had a stroke Saturday night, and died Tuesday night because DNR, and he didn't want to be hooked up to a machine. He did not smoke. He barely drank, just on he'd have a drink or on a social occasion or something. He was very outgoing. He was only 43, and here goes a stroke
Oh,
brain. You never know when we're only given one day at a time.
That's the whole
yeah.
point. Wanda, my neighbor's daughter, Monday afternoon had an aneurysm and passed away next door.
Yeah, I
And,
remember.
and it does make you think about those things, don't it?
Yeah, it does. So, I mean, it's like when I think about, I only take like 3 cigarettes to work. I won't smoke in my car. I don't, I'm trying like crazy. You know, it's hard. It's real hard. You
But
know,
you're
I know,
doing
Wanda,
great
I'm
and
the
you're
honest
taking
smoker.
steps. And I'm looking at this interview that I did with Dr. Miguel Montero Baker, and I'm looking at his words right now on the screen, and it says, it starts with baby steps, then bigger steps and bigger steps, but it's all up to you. But the fact is you're taking the steps, Wanda, and you're showing up every single week, and you are slowly. You have to go at your own pace, and everyone's going to take a couple steps forward, maybe a couple steps back, but keep trying to make that movement forward, and you're doing it.
But think
yes.
about where you started, Wanda, when we
Oh,
started
God.
this journey and where you are today. There is a big difference from when you started to where you are today.
Yes, definitely.
Absolutely.
And I didn't care. I mean,
Wow.
it's not didn't care. It was like I told this doctor that I'm seeing now, I said, I was raising a teenage boy. I said, I did not have time to be sick. I said, and I'm kind of mad because I have this disease. And he was just listening to me, you know. And of course, now my son is 29 and he listens to me. He doesn't vape. If he has a beer, he's going to. I said, why are you smoking a cigarette? You know, and now he's got his fiance's father telling him the same thing.
Yeah.
So it kind
Good.
of, he's
And
listening.
I do remember the rationalizations and excuses you were making. I do remember those.
I'm
They were
sure.
some really good ones.
Yeah, I mean, I'm a true blue addict. I admit it. You know, I mean, reality sucked. You know, and you're going to tell me I can no longer smoke. You know, well, okay then.
So, what about you, Alan? How are you? And what do you think about hope?
Oh, yeah.
What do I think about hope?
Yeah,
Yep.
Hope is very fleeting.
Mm, this is true. Someone said that.
Um, I started in 2017 with my chronic pain, and that's all I had for about 6 years. And through that time, there were periods when I thought that my chronic pain was improving, and then something would happen and I'd go back downhill. And I just kind of kept going up and down and up and down for about 6 years. Never, ever made any significant progress. And then in 2023, I got diagnosed with anemia. That made me horribly sick. And for
Oh,
a, for a 4-month period, I didn't even think about my chronic pain. All I thought about was anemia. And then once I started to improve from anemia, within 2 months, I was diagnosed with P.A.D.
Dang.
And
oh, just like Beth, it's just like one thing after another, right? You just
yeah,
can't catch a
yeah,
break.
yeah.
Yep.
And for a year, I focused pretty much on P.A.D. plus chronic pain with anemia kind of in the background. But I had a couple of months where the anemia came back like gang horns, and when that happens, P.A.D. and chronic pain were put on the back burn. And then I got diagnosed with neuropathy in 2025.
Gosh, on your feet.
Yeah, yeah.
Feet and legs.
And that didn't stop me from working on the P.A.D. It just made it a little different, but I kept working on the P.A.D. So for the last few years, I've been battling my chronic pain, my anemia, my P.A.D., and the neuropathy. And, you know, some days you think you're making progress in one area and then another area flares up and it all goes away. And so that hope, it is very fleeting. It just comes and goes depending on what's happening in your body. You know,
And
and
what
now,
you've been through in the last 6 months
well, yeah,
is,
yeah,
is an amazing, because if a lot of us, if we look at you today and listen to you today and what you sounded like a month ago before you
Yeah.
got out of the hospital and where you are
Oh, I didn't
today,
even
it's
see
like,
Marie was here.
it
yeah,
was
yeah,
like, it's crazy, isn't it?
yeah. I mean, I was in the hospital 4 times. Um, the worst time for almost 3 weeks, and in so much pain, and for at least 5 months in so much pain that I couldn't function. I couldn't get out of bed. I couldn't look after myself. I couldn't make meals or go grocery shopping. And when you're dealing with that, well, you're not thinking about PAD, you're not thinking about neuropathy, anemia, or anything else. That's all you're thinking about is the pain you're feeling. And so that's really frustrating because you kind of lose hope with
Yeah.
everything else.
That's
You
that
just,
question I always ask you, isn't it? That same question I always ask you. What if you had an answer to that chronic pain today? How different would that make you feel?
sorry, say that one more time.
If you had an answer to why you have that chronic pain, how would that make you feel? Would that make you feel different, or would
It
that
would,
give you something at least to look at?
it would make a massive difference. Absolutely massive difference. When I first got diagnosed with PAD, I knew nothing about it. And it scares the heck out of your brain.
Hmm.
And you have no idea what to do. And you feel like this is a death sentence. That's what it feels like.
Yep.
And then the more you learn about the disease, and the more you learn about the things that you control, the things that you can do, the easier it gets. And you start to come up with plans. This is what I need to do to help myself with my PAD disease.
Right.
When I left the hospital a few weeks ago, and the doctors, I'm grateful to them that they got my chronic pain down to a manageable level. But when they said to me, we have no idea what's causing your pain, and we don't think we'll ever know what's causing your pain, that just causes immense frustration, um, fear, loss of hope, you know, because you realize that you're never going to be able to fix this. You're never going to be able to cure it. All you can do is hope you can keep your pain level under 5, you know, and
Yeah.
given what they've done, and they got my pain level down to 4, if my pain level shoots up to an 7 or an 8 or a 9, it's going to scare the hell out of me. Because what do I do now?
Is it,
So,
and that goes back to that part when your pain level reaches that, it just completely stops you dead in your tracks, don't it?
When it hits
yeah.
9, it's debilitating.
Mhm.
You can't function.
But what's
Mm.
really good is when it's down now,
Yeah,
I'm sure that it gives you hope that you can also start to see if you can wean off the nicotine, right?
yes,
It
yes,
starts to make it, because that was a vicious cycle in and of itself.
yeah,
And so now that you have other methods to control that, I know that the cigarettes were a crutch. You talked
yeah,
about that.
yeah,
And now you can start letting go a little bit. It's going to become more habit versus the real need for it. And so I look forward to seeing your progress, because I know you've been trying, and I just like want to give you so much credit for showing up week after week and talking about it and giving it a try. Everyone's on their own journey. There's no judgment. And we're going to help you every step wherever you are. in
Thank you,
that journey.
thank you.
So,
Thank you, I appreciate that. And I'm also hoping that I might be able to wean myself from some of the drugs, because I'm taking about 25 pills a day.
yeah, that's
And
hard.
I'd like to get down to 5 pills a day, quite frankly.
Yep. But I
Yeah,
also love that you bought a walking pad. You
yes,
show up for our diet program. And so I love some of the things that you cook.
yes,
So excited
yes.
to
And
get
He-
into
he-
winter to see your
He's with
soups.
us every Monday night in our smoking group.
Yep.
even when I'm doing bad, I go.
Yeah, he's
Yep.
trying.
He is.
And
I've got a neighbor down the hallway there. He's 79 degrees and he's got some heart issues. And he is now walking 5 to 8 miles a day. Yeah. And he's he's a very determined guy. When a doctor told him you need to start walking, he started walking. And
awesome.
he
Yeah.
a couple days ago, I was having a chat with him and his wife, and they told me they were worried about the winter time. So I brought them over and I showed them my walking pad. He's already ordered one.
That's
All
amazing.
right.
Look what an inspiration you are. You're
Yeah,
giving hope to others.
That's
well,
wonderful.
and I'm really happy for him because he's a very positive guy and he's a problem solver kind of guy.
Yep.
Give him a problem, he will find a way to solve it. I don't care what area field it's in, he'll find a solution. And he saw what a simple solution that walking pad was. And he's
Yeah.
already ordered, so I'm so happy for him.
And we
It's
all getting
genius.
prepared for next summer, Alan, because Alan has an amazing friend that lives on the beach in Mexico. And we're all getting ready to make a trip next summer to Mexico and hang out
Yes.
together.
Yeah.
We're doing some grounding in the sand. We have to get those calves strong enough to manage the dips in the sand.
Yes, yes.
So I want to
Thank
jump
you.
in. I want to check in with a few others on here. Thomas, you had your appointment today. I had some words with your main doctor, and it seems like
Yeah,
you might have a little bit of hope.
of course. Every day I've always got hope. More so because of P.A.D. group, you, Douglas, everyone else. You know, I had two bad surgeons. I'm not going into it. One did the wrong leg, one messed up the other leg. One
Oh,
left a clip in me. But when I got into the group, you sent me to a good wound care specialist. That's all I'm saying on that subject. They were really good. They saved my leg. But then after that, I got to where I felt I had no hope because I didn't know anywhere to go to. Anyone else I could go see. I think this is my seventh surgeon, cardiologist. But they finally got it right. They have a wound care team. They have the best surgeons, um, and everything else under one roof. You know, um, my the surgeon I've seen today, he is very knowledgeable and everything else. You know, he come in with a smile. He come in and he told me, he said, "You look healthy." He said, 164 pounds. And I was like, "Is that bad?" He said, "No." He said, "No, you're not fat. I'm lean." And he spoke about the possibilities of several procedures, you know. But I can never give up hope, Kim. Even if they did a procedure and it failed, I'm always hoping for the next day that maybe some other procedure will come out that's right for me. You know, um, a lot of reasons for me not being able to have new procedures and other stuff like that is because the mess of all my arteries and all my veins and everything else, minus veins and um, but yeah, Dr. Walker, he always gives me hope.
yeah.
The whole team, they really did take me under their wing. I mean,
And I
Doc,
guess he says that his nephew is a rock star and his nephew has
right,
taken you under his wing. So
yeah,
his nephew really wants to take care of you.
That's
right,
great.
and I said to him today, you know, he come in, and I've always got on great with them. They're always like happy, bubbly, and and serious when they need to be. And he sat down and he said, "Well, look," he said, "before I start," he said, "I want to see your feet." And he looked at my feet. He took right and left leg, no pulses. They're 100% completely. But what he wants to plan to do is get a certain procedure done. If that turns out for the best and it works, then he's going for the left leg through insurance and tell them, look, this works. You know, whether insurance will fall for it or go for it, I honestly don't know. You know, but I just got to keep going and going and going. You know, for going back to the gym, I was always at the gym before P.A.D. But then I seen John Dent. He really inspired me. And I messaged him. I said, "John," I said, "thank you." And he's like, "For what?" I said, "You inspired me to go back to the gym. You know, if you see me like 10 months ago, I looked deathly, deathly ill. I really did. And I didn't feel good, you know. So now my hope is with new procedures coming out, should give everyone hope, you know, whether they can have this one or that one or another one. But it also gives me hope that I can go to the gym every day. You know, a lot of people can't go to the gym. You know, they have no legs, or they only have one leg and stuff like that. You know, so it's just I'm hopeful for everything really. You know,
Every time I think about you, I get online. It's like, I wonder where Thomas is. I just get online and I kind of automatically know now where he is.
yeah.
World Gym, World Gym, World
Well,
Gym.
I'm going to tell you something, but I wish it was with PAD people. The amount of people I've told, and they'll ask me about the gym and everything, you know, they're like, "Oh," and I'm like, "Yeah." I said, "You just really need to go to the gym." Well, 6 of those people, out of about 10 people, they're at the gym. Can you
Oh,
imagine if
wow.
that was for PAD people? You know, look, maybe if you go to the gym and do this little exercise here, this will help you, or you know. So yeah, I mean that's not my full saying. Go to the gym. I'm not going to say it, but it's go to something gym. And
Do
okay,
something.
but yeah, it's just funny though when you see them in the gym and they're looking at it like, "Do I know you?" I'm like, "Oh," and they're like, you know, but I don't know. There's times I felt like I didn't have any more hope left with insurance, you know. Um, that was kind of the last straw for me, but I thought, no, there's got to be something, you know.
We're still having the insurance things, and that's what's so disconcerting is that
Right.
they
But
don't
you know,
see
Kim,
you as a face.
right. But you see, the problem is, Kim, as much as I want them to go in and get into all my arteries on my left leg and everything else and try this or whatever else, I told McCall today, I said, look, I said, my hope is if this leg works out good with the procedures you want to do on it, the whole leg at one time, then I'm hoping that they're going to see some daylight and say, well, look, let's try this in the left leg. But honestly, I don't know, Kim, but I'm just thankful I'm not in the UK because I know by now I would have lost my leg like 2 years ago.
Wow.
Well, you
You
know,
know
we
that?
got your back, right?
Oh yeah, 100%, Douglas. But even in the UK, if I went over there now with this, 6, 7 months I get in to see a doctor, 3 to 6 months to see a specialist. By that time, they're like, we're putting you on a 12-month list and that's it. You know, because they don't want to go through all the problematic stuff that you have. You know, and someone explained something today at CIS. Each time I went in, because my P.A.D was so bad and blocked for so many years and everything else, they could only unblock a little bit at a time. So by the time it come round to doing the next section, the top section was already blocked again because it couldn't go any further than, where the blockage was. And so their idea is to do the whole leg at one time on the 28th of October, insurance allowing.
Right.
Yeah. Good.
Yep.
It reminds me, go back just a second to something Alan said. How many of us, when we first heard the word P.A.D., within the next hour, we Googled it, and within 5 minutes, we all thought to ourselves, well, I'm going to be dead in 5 years. Because when you Google it, that's what that kind of comes up automatic, doesn't it?
Yeah,
Right.
it does.
What come up for me when I searched it, okay, was about the disease. The only thing about 5 years lifespan was if you had amputation. That was the only bit I come across with the death rate of it.
Yeah.
But what they told me the start was, I just had slight PAD. But when they did all the testing and scans and everything else, they put me advanced stage PAD. And I'm like, you know,
Yeah.
we just have to try and live the best we can with it, you know, doing little stuff. You know, I didn't know that PAD would cause all these extra problems and everything else. You know, I thought, well, once they done the bypass, it would be good. And it failed 2 weeks, you know. But
Well, you
in
know,
my
you give us hope, right?
yeah, you have to, Douglas. You know, Kim spoke to me on my insurance thing, and she said, you know, she was talking about the death rate, mortality rate with amputation. More for me because I'm blocked the whole leg down. It wouldn't heal, you know. And I told her, I said, Kim, I'm not afraid of dying, but I'm afraid of dying under the hands of a surgeon in a hospital bed.
Right.
You know, that's the biggest fear I have.
Yeah.
Yeah.
You know,
So, and we're glad you're with us.
oh yeah, I am
Absolutely.
too. Every day I've got a smile.
You know,
Sometimes I fake smile, but hey, I've still got a smile. You
Yep.
know,
You always do. And you always have such positive spirit. And
you have to. You know, people ask me, why are you so positive? I said, well, look, I said, why be negative? I said, if you think negative, you're going to live a negative life.
Right.
You know, I said, what if I turn around and said to you negatively, you know what? Be careful crossing that road. A bus may come and run you over. I said, you got to think in the positive side, you know?
yeah.
Walk
I'm gonna
across
get
the
up and
road, there's
drive
no buses
over,
on
and
your front. Exactly. You know,
I'm gonna.
you have to be. And I know it's hard for some people to stay positive. You know, I think we've all got that trait in our bodies, you know. But if someone's low on something, I find a way to perk them up, you know.
Yeah. I'm
You
still
know,
gonna drive over, and we're gonna have go. We're gonna have to go have some gumbo.
Oh.
yeah. So long as there's no gator, no crawfish, no seafood in it.
Okay.
Yeah.
Maybe Louisiana.
Where
Where
But
are
I
you?
just want to say something quickly.
Yeah.
While we're on about this being positive, there was a time between insurance and procedures not being able to get done for me. I went through really, really deep depression. I went through that for weeks on end. But I always like to deal with it in my own way. But sometimes it's not the best way. You know, I shut myself
Yeah.
off straight talk. There was one person in this group tonight that got me through my depression without even knowing anything about it. Was Becky. She'd chat to me back and
Becky.
forward. She'd chat to me back and forward on Facebook, you know. And sometimes it's just having someone there that may not understand what you're going through, but just help get you through what you're going through.
Yep. She messaged me quite a few times.
Mhm.
It's like,
Yeah,
are we going to get Thomas through this? Are we going to get Thomas through this?
yeah.
And it's so
I,
nice
I,
to have that circle of love in the group that
yeah,
everybody
it
is
is.
watching out for each other.
Yeah,
Yeah.
and although you may not chat to someone every day, it doesn't mean they're not wanting in your friend circle. Know what I mean? Like, you know, because
Yeah.
everyone has a life off of like Messenger or chat or whatever. And there's some days I may go quiet without talking to anyone on Messenger. You know, I deal with a lot of stuff and I post a lot of stuff. But the
Yeah.
stuff I post is It doesn't bother me if it makes other people laugh or paid off or anything else. But at the time when I post it, it makes me feel better because it gives me a laugh. You know,
Yeah.
I always wonder about my goofy videos.
I don't like them.
I like
I
your
do
goofy
watch them.
videos.
Oh, I
Do you know
watched-
Douglas? I remember when I first met Douglas, he was in hospital having that bypass. I never spoke to Douglas before, and his brother come into the group. I'd only been in there about, I think, 2 days. And his brother came in and said, Douglas is doing well, rah, 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 rah. But he
Yeah.
said to tell everyone, walk, walk, walk. And I was like, who is this guy? You know, that always stuck in my mind, you know what I mean? Who I never even knew you, Douglas. You know what I mean? It was just crazy how like your brother come in and he told everyone to walk, walk, walk. Here's Douglas all draped up and everything else, and yeah,
I remember that. Yeah.
We be kind of special.
Yeah.
So, thank you, Thomas. Marina, how
Yeah, we
about
haven't
your
checked in with
hoe?
Marina yet. How's Marina? Marina, how is your walking program? Did you start?
It starts next week.
Oh, I'm
have to
so
wait 2 weeks.
excited. I'm guessing that gives you a little bit of hope.
That gives me a lot of hope, a lot of hope. But today, unfortunately, Kim, I went to one of your sessions with Dr. Raja this week,
Oh.
yesterday, I think, and listened to
Yeah,
it.
that was-
And you guys talked about the P.A.D and what's the company, Endologics and all
Yep.
that good stuff, right? So I did a little research. I went to the website, and there's a list of doctors there that do the procedure. And my doctor is listed on their website. So of course I went and typed him an email through the portal, and I asked him, would I be a candidate for this P.A.D instead of a bypass? And he got back to me this afternoon and said it would not be a good option for me. Now he didn't go, it was over the portal, so he didn't go into details. And he said, next time I go to see him, we'll go through the images and he'll talk to me a little bit more about why this is not a good option. But I was really.
It'll be interesting. So it's indicated for only a certain amount, but what's interesting, the question to ask is, if he was involved in this study, does he currently have access to it right now because they expanded its use? There are doctors that are using it beyond the confines of what were the parameters in the study. And so I can find out from the company as to whether or not your doctor is involved as well, beyond, if he's still using it today beyond the study, because sometimes it just takes the rep to go in and say, hey, yeah, it was very narrow during the study, but we've expanded. You can use it for X, Y, and Z. I don't know how that works, but it's worth having the conversation with them. The hope is that you won't need anything, if at all, for a long time, if the walking program works.
Right. That's my saving grace here. That's why I'm hopeful that come the end of the year, I can at least walk 30 minutes, and not even
Yeah.
need to talk about that procedure or bypass with them. That's my hope,
Oh,
But
see, that's a great goal.
I just wanted to have something in the back burner,
Well, we also talked about maybe getting another opinion, from
Yeah.
someone who has additional within the same system, one of
Yeah.
his colleagues that might have additional options for you, different doctors, different tools, different techniques, different favorite methods of
Right.
treating. You might just be able to, have even one more minimally invasive good old try. But we find so much success in walking as medicine. I'm really excited to follow you on your journey from day one. And hopefully you'll keep everybody up to date in the group on your progress and maybe sharing what you're learning along the way, so others who don't have access to one of these types of programs can gain some insight from your experience.
Yeah, absolutely. I'd be happy to.
And
You're gonna
Imelda,
become the walking
hello,
queen.
Imelda. Imelda is here. Imelda is chatting us up in the written
In the
chat.
chat.
Yep, she's chatting us up in the written chat. She's going to get involved in our Monday eating group. It sounds like on Mondays we have a really great diet group with world-renowned diabetes reversal expert Dr. Danziger. And I think on Monday we're going to be talking a lot about smoothies and all the different ingredients that you can use for the different types of smoothies, things that you can hide in smoothies that are healthy and you don't normally want to eat, but maybe you can hide it in there with a few extra strawberries that help hide the
Strawberry,
taste of the
strawberry,
spinach.
strawberry,
Yes.
strawberry, strawberry.
Hey, Kim?
Hey, I have
Yeah.
a quick. I
Sorry,
got two names mixed up earlier. Becky has helped me over my depression. I meant to say Beth.
Aw.
Oh, I was
Yeah,
wondering
she
because
would chat.
Beth
Becky,
was here, you
Becky
said, in
too,
the
you
group.
know.
So
Yeah, Beth did a lot because she would chat back and forward. Know what I mean, without knowing anything that was going on and stuff like that. Yeah, Becky, she always makes me happy and smiles at stuff she sends to me and like
Mm.
Messenger, you know, some crazy posts and stuff like that. So, but yeah, in fact, everyone's helped me with it. Get over it, you know.
it's all a
Teamwork.
group effort. We're all family.
Yeah.
So it was so
Yeah,
fun
we
catching
are.
up with everyone. I really appreciate it. And I think that we will do a to be continued next week. We do have someone who is in our network who is a student researcher in the US at a college, and she does want to join one of our hangouts and share some of the research that she's doing and ask for our help and stories about how doctors talk to us about pain, how doctors perceive your pain. Do they come from a place of understanding? Do they seem to empathize? Do they have compassion? Do they help you find solutions, or where are the gaps in care? So it'll be a really good conversation. If she comes next week, I will let everyone know ahead of time, because, you know, when you have someone from the outside in the group, I always want to make sure that everybody is aware who they are and what they're doing. But she wants to post the survey in the group, and until you all meet her, we don't allow researchers to just blindly post in the group because it takes trust. You have to know who she is as much as she's
Right.
getting to know who you are as well. And for the diet group, Imelda is asking about the diet group. Imelda, I just need to add you in our EMR system to the diet group. And then also I need to add you to the weekly calendar invite. And then you can join and ask questions of Dr. Danziger every single week. It's like having your own personal dietitian. So
Kim, could you add me to that group also?
sure, I might as well do it while we are on. I can go ahead and add you guys. Put your emails in the chat and I will go ahead so I do not forget. I will add you
would,
guys to that.
Kim,
What's that, Alan?
I would de-emphasize the diet part because it's really for anybody who wants to eat healthier.
Yeah.
Whether you
That's a
need
great
to
point.
diet or not.
That's a great point. Yeah,
Yeah.
the diet isn't the best word. It is healthy eating, whether you're diabetic, whether you're just looking for tips and tricks for artery health.
Yeah. Yeah.
So go ahead and put your emails in there. I'll get those. If anyone else who is watching wants to sign up for our weekly meetings, make sure we broadcast them live so you can always just watch them right here on your YouTube channel. Go ahead and like this video so more people can learn from everybody's experiences. Subscribe to our channel and hit the little notification button to make sure to get notified when we have great content like this. But
Can
we
I ask
appreciate
one
everyone joining
question?
us. Thank you, thank you, thank you so much.